Hello, we're going to discuss about lymphogranuloma venereum. It is a sexually transmitted bacterial infection.
Lymphogranuloma venereum, or LGV, is a long-term infection of the lymphatic system. It is caused by any of three different types of the bacteria Chlamydia trachomatis. The bacteria are spread by sexual contact. The infection is not caused by the same bacteria that causes genital chlamydia. LGV is more common in Central and South America than in North America, and is more common in men than women. The main risk factor is being an HIV positive.
Symptoms of lymphogranuloma venereum can begin a few days to a month after coming in contact with the bacterium. Symptoms include drainage through the skin from lymph nodes in the groin, painful bowel movements, small painless sore in the male genitals or in the female genital tract, swelling and redness of the skin in the groin area, swelling of the labia, swollen groin lymph nodes on both sides. It may also affect lymph nodes around the rectum in people who have anal intercourse, blood or pus from the rectum.
Tests may include biopsy of the lymph node, blood tests for bacteria that causes LGV, laboratory tests to detect chlamydia. A physical exam may show an oozing abnormal connection in the rectal area, a sore on the genitals, drainage to the skin from lymph nodes in the groin, swelling of the vulva or labia in women, swollen lymph nodes in the groin.
LGV is treated with antibiotics including doxycycline and erythromycin. With treatment, the outlook is good.
Signs and symptoms. After exposure to the infection, a small ulcer or sore develops but may not be noticed. This can be on the penis in men, in the vagina or around the outside of the vagina, vulva, in women, or on the anus. In men and women who have anal sex, this ulcer or sore can occur in the rectum, back passage. This ulcer or sore can heal without treatment, but the infection has not gone away. Between 2 and 6 weeks after initial infection, the lymph glands in the groin or inside the pelvis will begin to show signs of infection, becoming very swollen and painful. The infected person may become unwell with fevers, aching muscles and joints, and headaches. In anal infections, a person may experience pain, discharge, bleeding, constipation and/or inflammation. The infection can spread to tissues around the lymph glands. In the groin, this can cause large sores which break out on the skin. Inside the pelvis, this can involve the vagina, the rectum and the bowel. Treatment, blood tests and swabs from the infected ulcers or glands are used to test for LGV. These tests and others may also be used to test for other causes or infections. LGV is treated with antibiotics that need to be taken for at least 3 weeks. To ensure the infection has been cured, it is important to take all the tablets and that you do not have sex until you have finished treatment. You also need to return to your doctor or clinic for a follow-up appointment. If you have LGV, anyone you have had sex with in the past few months will need to be tested. This is to make sure that they do not have the infection and to prevent you being reinfected. If you feel uncomfortable or embarrassed about telling your partner or partners, a member of your healthcare team can assist by contacting them for you.
Your name is not mentioned to ensure it is a confidential process. Advising sexual partners of their exposure is essential for their health and the health of any other people they may have had sex with. Transmission, LGV is spread through unprotected vaginal, anal or oral sexual contact, especially if there is damage to the skin or mucous membranes. It can also be spread by sharing sex toys between partners. In Europe and North America, LGV has been increasingly diagnosed in MSM, and especially amongst men who have anonymous sex with multiple partners, practice fisting, practice rough sex, or share sex toys. Many of these men also have HIV, other STIs and hepatitis C.